Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 8 homeopathic remedies for Omalgia. What is Omalgia? How does it originate? Omalgia or rheumatism of shoulder joint is a type of arthritic affection. The big muscle involved here is deltoid. The picture has been given right hand side below. A large triangular muscle. This disease is also known as periarthritis of shoulder. Origin of this ailment may be various, like irradiation of neurological, vascular, cardiological and intestinal origin, collectively called extrinsic conditions. Intrinsic conditions, when pain has its origin at articular or periarticular level, including bursitis, tendinitis, capsulitis, etc. According to the primary trauma care manual, 90% of cases are due to periarticular problem located around the joints like ligaments, muscles, tendons and capsule. And the remaining 10% of the cases, the pain intra-articular, this is occurring within joint. What are signs symptoms of Omalgia? Limited mobility hampering with daily movements like keeping a book on the shelves, etc. Pain intensifies at night, especially when sleeping on affected joint. Pains may be intensive enough to spread to cervical region, forearms and hands. Troubles sometimes may persist over a year, and it is reported that in a few cases the patient had to lose their services for long absenteeism from the workplace due to this particular rheumatic Omalgia. Note the point: to lose their job for absenteeism from workplace, they may be absent for years, for a year or more so, and as a result they lost their job. Are Omalgias serious? In most cases, Omalgias are not something to worry about unless it is associated with some definite neurological issue. This issue affects brain that control muscle movements. If involuntary muscle movements occur from a neurological issue, it is known as dystonia, and obviously it is a serious state. When one gets chronic muscle cramp with other signs and symptoms like pain, poor coordination, weakness of muscle, it is time to take the same seriously. What are other signs symptoms associated with Omalgia? Muscle pain and weakness, numbness, paralysis, coordination issues, chronic sleeping problems, vision problems. What are the causes of Omalgia? Experts in this regard are not sure as to why a section of people get more Omalgias than others. However, most of them think that any or more of the following conditions, any one or more of the following conditions are to blame: dehydration, electrolyte imbalance, excessive stress, too much high intensity exercises, exercising in high temperature, muscles fatigue, improper stretching. How can Omalgia be prevented? Drinking plenty of water, taking required electrolytes, avoiding too much of strain, avoiding addictions like smoking, alcohol and others, by proper relaxation of muscles after exercises, by taking adequate rests and recreations. What are general management of Omalgia? Stretch the affected part softly, massage affected part with hand or massage roller. Affected person should stand up gradually and move about gently. Discussions about treatment of Omalgia with homeopathic remedies. Sanguinaria for Omalgia. Affection mainly occurs on the right side. Burning in soles and palms. Much pain in places least covered by flesh, not in joints. Better feeling when touching the affected part. Rash talks for Omalgia. Hot, painful swelling of joints, tearing pain in tendons, ligament and fasciae at night. Pain severely felt during first movement, thereafter they gradually went down. Numbness and formication after overwork and exposure to cold, wet weather. Bryonia for Omalgia. Stretching, tearing pain worse by motion. Better from rest. Patients irritable, feel vertigo when head raised from pillow, lips parched, dry, thirst for large quantity of water. Medurinum for Omalgia. A good remedy for chronic affections. Affected part feels heavy, burning sensation, restlessness, pains intolerable, think that time passes too slowly. This is a mental symptom. Think that time passes too slowly. Medurinum related very important mental symptom. The patient think that time passes too slowly. Sulfur for Omalgia. Hot, sweaty hand, especially left joint affected. Heaviness and paralytic feeling. Paralytic means paralytic. Burning in soles and palm at night. Sweat in armpit smells like garlic. Belladonna for Omalgia. Head and feet sweat. Feet sweat offensive. Patients nervous and excitable. External impressions readily awakes convulsion. External impression means the external environmental disturbance like sound, light, these are external impression. Readily awakens convulsion, that is increases convulsion. Sibilinum for Omalgia. Pain worse at night, less during day. Redness and rawness between toes. Feels as if going insane or being paralyzed. Very hopeless. Think their disease is incurable. Tuberculinum for Omalgia. Highly depressed, melancholic patients. Fear dog intently. Tendency to curse and swear. Tonsils enlarged. symptoms constantly changing, very sensitive physically and mentally.